So after infection, the second biggest threat or complication which is seen in a nephrotic syndrome patient is increased risk of thrombosis and thromboembolic complication. The question is why? Why we have this patient have increased risk of thrombosis or thromboembolic complication? To understand this, you need to understand that our body, normally there are two kind of factors are there. One called procoagulant factors, another called anticoagulant factors. Procoagulant factors are normally there because we can bleed at any point of time. To stop that bleeding, we need to form a blood clot. Those are called procoagulant factors. These coagulation factors like fibrinogen, thrombin, all these factors, 5, 7, 8, all this. Another set, so that our body should not produce unnecessarily blood clots, we have certain, to stop that, we have also some anticoagulant factors to stop unnecessary blood clot formation. They are called naturally occurring anticoagulant, protein C, protein S, and antithrombin 3. What happens in nephrotic syndrome patient is that there is an increased urinary loss of this naturally occurring anticoagulants occur, including antithrombin 3 and also protein C and protein S. Plus there is an increased synthesis of the certain procoagulant factors have been seen, fibrinogen, factor 5. So what happens as a result of this, the balance gets tilted in favor of the coagulation. That means there is a more increased tendency of blood clot formation because we are losing naturally occurring anticoagulant, plus there is increased synthesis of the procoagulants occur from the liver. As a result, there is a more tendency to clot formation, thrombus formation, and whenever there is a thrombus formation, the thrombus can be dislodged, broken and dislodged, and result into a thromboembolic complication. So nephrotic syndrome patients like membranous nephropathy, they are very much at increased risk of certain complication like deep vein thrombosis. There could be renal vein thrombosis, and there also could be seen is the thrombopulmonary embolism. This complication can be seen, and the reason is this, that there is a disbalance in the procoagulant and anticoagulant factors. There is a more loss of urinary loss of naturally occurring anticoagulant, and there is a more synthesis of the naturally occurring procoagulant, and that results in this disbalance, increased risk of thrombosis and complication. Thank you so much.